Hi, everyone. Good afternoon. Welcome. I know many folks are joining, so we'll give a little bit of time, a couple minutes for people to filter in, and we will get started with today's webinar. Thank you, everyone, for taking the time out of your day and your week to join us. Once I see that our participants have kind of leveled off, I'll go ahead with introductions, but giving a few moments here for folks to join. All right. Okay. It's nice to not see everyone, but glad to see that people are here. My name is Dr. Emily Hugh. I'm a licensed clinical psychologist at the NYU Child Study Center. I'm a clinical assistant professor as well at NYU Langone Health. And today I'm very excited to talk to everyone about empowering autistic girls. In particular, going to be sharing about a targeted support group and curriculum that was developed here at the Child Study. I'm going to go ahead and share my screen. All right. Okay. So today I'm going to be sharing with you about a targeted support group curriculum that was developed with the idea of really focusing on empowering autistic girls and their identity development, sense of self-esteem and self-efficacy, and trying to think about handling the perhaps unique challenges that autistic girls, particularly teen girls, face. All right. So this workshop is brought to you by the New York State Regional Center for Autism Spectrum Disorders at the Child Study Center at Hassenfeld Children's Hospital. Please note that this content is presentation of informational information and not clinical advice. I do want to acknowledge, have a special thanks to two NYU undergraduate students, Ellie Lucero and Yvette Ma, who participated in developing this program and were very pivotal in the research and putting this together over the summer of last year. They were incredibly helpful, and we could not be doing all of this without them. So I want to make sure I acknowledge them. All right. So our agenda, what we're going to cover today, and time will go by fast because 30 minutes goes by very quickly. But I'm going to share a little bit about what we know about autism in girls. This is by no means going to be like a deeply comprehensive summary. I think this is something that we still have a lot more to learn and research, but I'll share some of the things that I think are important given the context of the support group. And then I'm going to spend time talking to you about this social support curriculum. And this is really focused on autistic teen girls and female identified individuals. And then hopefully we'll leave some time for questions. All right. So thinking about autism in girls specifically, you certainly may have heard this term used before. This is something that we more and more try to describe as we try to understand the very wide and kaleidoscopic spectrum that is autism. And so one of the kind of phrases that have been coined by autistic self-advocates is if you've met one autistic person, you've met one autistic person. So the same goes for autistic girls. We think about the different kinds of ways that an individual may demonstrate social skills and social differences and patterns, focuses, fixations, interests, routines, sensory differences, body behaviors, social perception, cognitive perception, executive functioning, and so on. This is different depending on one person to the next. So, one of the things that we are hearing more and more and knowing more and more is that there are an increasing number of women and girls that are referred for evaluation of autism. The reality is that we still have a long way to go. Historical and ongoing gender bias exists towards more diagnoses being made for males than females. I think it's pretty important to share some recent, as in just published research as of this month, new prevalence rates. So previously, prevalence rates were 1 in 36 of individuals aged 4 to 8 years in the United States are diagnosed with autism. Now the prevalence has changed to 1 in 31. The ratio of male to female diagnosed with ASD is still biased towards males, about 3 to 1. So that means for every 3 males diagnosed with autism, 1 female is diagnosed with autism. But one of the things that we know for certain is that the core difficulties, as well as characteristics, traits, etc., in autism are the same for males and females. However, what we know is that there may be more subtleties in how these characteristics are observed in girls and women. And so what that can mean is that there's a greater misdiagnosis or lack of evaluation or attention paid to children who, especially women and girls who may need an evaluation and certainly could meet criteria. So interestingly enough, there's some research that looks at, the kinds of social challenges or impairments for females with autism versus males. And there's some research that shows that it may be more difficult for autistic girls to be friends with their neurotypical females. One of the ideas might be, again, because of the kinds of social expectations that are on there for girls, also the kind of social norms, let's say, about how girls interact and how girls are socialized to interact versus boys. I think from an early age, boys are conditioned to, let's say, connect more along the lines of their interests and activities. And girls are socialized to connect more related to kind of social factors, communication factors, conversation, kind of friendship characteristics. And so we can see why, in the case of autistic girls, some of those expectations may kind of put them at a greater disadvantage and challenge to relative to autistic males. These are some of the, kind of traits that we see that can be different for autistic girls relative to autistic boys. So in the domain of social behavior, so autistic girls can tend to show more empathy and compassion. Their kinds of social differences can appear more like shyness rather than some of the other kind of traditional characteristics we see socially. Autistic girls can make a much greater effort to fit in with their peers, to avoid unwanted attention, to avoid negative feedback from their peers. They can have a greater propensity for what we call masking or camouflaging, which can lead to, challenges in private, let's say through kind of social exhaustion. Generally can show less physical or aggressive behavior, and their difficulties may show more in terms of anxiety rather than behavior. More imaginative play early on. So I think this is where a lot of families can be dismissed by, general practitioners, because autistic girls tend to show more imaginative, creative play. They may show more eye contact and gestures, and even facial expressions. There was a recent study done that came out of Children's Hospital of Philadelphia and the Center of Autism Research that showed that autistic girls have a greater, range of facial expressions relative to autistic boys. So all things that can lead to either misdiagnosis or delayed evaluation. And then in communication domains, autistic girls can be more observing of the things around them. And perhaps that could also lead to, again, more camouflaging and masking, but also more sensitivity of feeling out of place and not fitting in. These are just a few of the ones that we know so far, but certainly not an exhaustive list. And so when we think about all of these things, we have to ask ourselves the question, what would be helpful in terms of supporting autistic girls specifically in regards to some of these social differences and social vulnerabilities. One of the most well-known evidence-based social skills groups is the PEERS program. So that's a program for the education and enrichment of relational skills, PEERS. This is a caregiver-assisted social skills group, covers a variety of topics, including conversations, electronic communication, humor, handling conflict, teasing, bullying, having get-togethers with friends. It was developed in 2004, and we are very excited that we get to continue to offer this as a longstanding clinical group here at the Child Study Center. This idea around a social skills and support curriculum for autistic girls really came out of the need and request of our families who participated in our peers program. One of the things that our families would say is, the peers program is really great. However, there tend to be more boys enrolled in the peers program here than girls. And we would really like girls to have their own space to be able to, let's say, talk about things related to social skills, but also, their identity and being able to connect with other autistic girls. So that really was the initial kind of impetus and inspiration. We did take some ideas from a curriculum called Girls Night Out. This was developed by Dr. Renee Jameson at Kansas University. And a lot of the same kind of, focus. So social competence, self-care skills, empowerment, independence. Girls Night Out uniquely does not occur in a clinic setting. So what they would do is meet at locations within the community. Wow, I love that. And I think that is absolutely wonderful. And I'm so glad that a group like this exists. We were really trying to think about, could we adapt something that was more appropriate to provide in a clinic setting? So getting right into it, the curriculum. So based on a lot of research, looking at what exists, the kinds of unique experiences of autistic girls, this was the formulation and general structure of what we think would be a really great way to address some of the unique strengths and challenges that autistic girls face. So I'm going to go over each of these in detail. And so the first session would be an intro group with the child and the parent. The idea is that, this is primarily a group for the teen, but we want parents to be involved and really know what it is that we're going to be doing together and be able to participate and support their child. And so we would go over welcome, we'd go over group norms, we'd elicit feedback from the participants about if there was any group norms that they want to add themselves. And we would go over the group structure. Each group session is designed pretty much the same. There's going to be a short lesson followed by an in-group activity. We would assign homework or some sort of challenge outside of session, and then we'd be able to check out or share out at the end to make sure that everybody understood what we were doing for the week. We would have icebreakers together. So the goal is to really understand, what are people interested in? What do people prefer? And so we'll have several icebreakers to identify each girl's, special interest or things that they like to do in their free time. Session 2 would be focused on psychoeducation. So we would explain why psychoeducation is helpful as an intervention tool, as a way to learn about ourselves, as a way to better understand our experience. We'd introduce masking and camouflaging. So certainly in some cases, some participants might know about that, but perhaps many don't. And so we would teach that. We would also talk about how masking and camouflaging can be stressful, can end up kind of causing challenges with identity development or kind of sense of burnout at home. And then we would talk about specifically traits, particularly to autistic girls. So we would go and do something similar to this kind of linear wheel, where we would ask them to describe, what do these things look like for each of you? And really trying to demonstrate that for each of us, it's all different. And then the homework would be in preparation for the next session. So that would be identifying an autistic role model. We would have ideas for them if they certainly had no kind of avenue that they would take first. But the goal would be for them to, in the time between this session and next, have someone that they identify so that they can share with the group at the next session. So the next session, so session 3, would be really focused on expanding, encouraging a positive autistic identity. So we would first have the share out of, did you get to pick an autistic role model? We would talk about why representation matters, right? So we know that if you're able to see yourself and see people like you doing things that, let's say, you wish or want to do, you have a greater sense of belief that you yourself can accomplish those things. Which then kind of brings us nicely to the next topic around discussing building up self-esteem, self-efficacy. We talk about uniqueness and really trying to embrace uniqueness, identifying ways of self-improvement that actually help make us more confident. That could include things related to independence. we start to introduce the idea of our, intersection of social identities, right? So really trying to embrace the complex parts of ourselves, whether that be related to our culture, our religion, gender, sexuality, all sorts of things. And then we have an in-group activity where we explore what their personal strengths are. The homework they'll be asked of that week is to complete an intersectionality wheel of social identities. So really this would be, again, to kind of promote the acceptance of differences while also understanding that like we are made up of lots of different parts rather than just being seen as one thing. Okay, and then session 4, this would be on self-advocacy. So we would discuss the importance of self-advocacy. We'd brainstorm together some ideas and areas that, we want to be better self-advocates in. Being able to practice self-advocacy and the kind of social scripts that we might use is really helpful. So we would do a lot of behavioral rehearsals. For example, we might practice how to correct someone's mistake. If they got something wrong, how to politely ask for them to, change our order or use a different name or those kinds of things. Asking for accommodations or deciding to disclose a diagnosis. For some, being able to know like when would it be appropriate and safe to do something like that. Handling teasing, handling peer pressure, and then handling an unsafe situation. And then the homework for that week would be identifying a specific area to practice self-advocacy. That leads us into session 5. So importantly, what we do know about neurodiversity and gender and sexuality diversity is that there are higher rates of LGBTQ identities among autistic people compared to the general population. A lot of people ask why that might be, but generally we think it's perhaps because, autistic people often have a unique perspective on social norms and identity. And we think maybe that can lead to more of an openness to explore or express a wider range of gender and sexual identities. And so we do think it's important to recognize and acknowledge and also build some sense of respect and acceptance around these diverse identities. So we will include a lesson that kind of describes that a little bit more in detail, but really focus it more on this kind of celebration of uniqueness and self-expression. So then our activity in group would be a self-expression vision board. A lot of these activities would use a lot of hands-on materials, artistic materials that would allow someone to express themselves in a visual way that is most kind of accessible to them. And then our homework would be actually to take that out in the world to some degree, in some aspect, in a way that feels safe to do so. So maybe that means kind of like putting a pin on that they wear to school or wearing some type of clothing that they really wish they could have worn, but they were afraid to previously. Changing their hair in a way that feels more congruent with how they want to express themselves. So these are just a few examples of what we might try to encourage. Session 6 is around friendship and love. Same thing. We're always going to start with a homework check-in and see how it went. We'd go into pretty clear detail about different types and levels of friendships and relationships. We'd also discuss the difference between neurotypical friendships and neurodivergent friendships, and both the pros and cons, or the challenges and the easy parts to both. We'd also talk about kind of red and green flags in relationships, and really break those things down concretely. Perhaps a fun in-group activity that we thought would be great would be doing something that really kind of bonds us, brings us together. So something like friendship bracelets. And then the homework for that week would be looking for perhaps representation in the media, be it a favorite TV show, favorite book, favorite comic, etc., that really shows the kind of characteristics of a good friend, or identifies, maybe differences in levels of friendship to really kind of bring about more social understanding of the different levels of these things, and also how to discern, discerning between a supportive friendship versus perhaps something that is more on the red flags continuum. Session 7, this would be focused on relationships with parents. So we'd start with the homework check-in. I don't know if anybody remembers this meme or clip from Mean Girls, but I think we talk a lot about how during this teenage time, there's a lot of tumults, there's a lot of changes happening. especially during a time when puberty perhaps is taking place. We also do know that in the case of autistic girls, there are connections with earlier start to puberty. So I think that's, relevant when thinking about how to prepare parents, but also for parents and their child to be ready to discuss these things together. I think this is an important one too, because we really want to highlight the importance of the parent-child relationship. It's very common, and I think a common misnomer is that teens are not really focused on their parents during this time of their life, but research will show that one of the greatest factors is parent-child relationship when predicting teen mental health outcomes. So we really highlight that to the teens. We do talk about puberty and some of the common challenges, changes, differences to emotion and wishes for privacy, etc. And then our in-group activity is to write a letter to your parents. And that is with the support of a structure. We would talk about how to use, neutral, positive language, assertive language, asking for different needs, etc., advocating for themselves, with the hope that our participants would share that letter with their parents. Session 8 is focused on handling and resolving conflict. The kinds of things that we would cover are defining and delineating between things like what's pure conflict and disagreement. How do we handle things like compromise and forgiveness with our friends and our peers? And then being able to discern what is teasing and bullying, and then what is harassment and assault. We do know that there's a higher risk for things like harassment and sexual assault amongst autistic females. And so we certainly want to be able to provide them with resources about how to respond to those situations, how to ask for help and seek safety. And so one of the ways that we'll demonstrate that is to do an in-group activity around knowing the difference. So we will look at different social vignettes as a way to kind of build, again, that social cognitive muscle to be able to discern. The homework for the week would be a conflict resolution journal. And so we would ask that if faced with a conflict in the next week, that they practice the steps around handling conflict and perhaps seeking compromise or forgiveness with a friend. And then session 7 is around wellness and self-care. This is when we would discuss in a lot more detail what autistic meltdowns, shutdowns, and burnout are. We would discuss physical and emotional well-being, and that would include things like movement and hygiene. We would talk about why, having a well-balanced plan in all of these areas kind of keep us balanced, keeps us regulated, being able to do the things that we want to do every day. And then our in-group activity would be either creating a crisis coping plan or a self-care plan, whichever they'd feel aligns more with their goals. And then the homework for that week would be practicing at least one self-care activity per day. A lot of these self-care activities may look very sensory-based, how to kind of take care of your sensory needs. For one, it could be how to recharge your social battery if you are someone who kind of gets feeling burnt out very quickly because of social activities. Okay. And then session 10 will be a parent-only session, and this is where we have the opportunity to review skills that we've covered through the whole group with parents, and really highlighting, why the parent-child relationship matters. We'll then ask the parents to write a letter to their child, similar to how their child wrote a letter to them, and really trying to focus again on empowerment, self-determination, positive self-identity. And then we ask the parents to think about, something that they can take from it. So some of that might be for them to seek their own support, to feel less isolated, to feel like a more competent and calm parent amidst all of the challenges, and then continuing to find supportive social and special interest groups for their child. These are just a few that I think are really great that are in the local area. Extreme Kids Crew has girls only or female identified groups. Felicity House is a great resource, as well as My Circle of Girls. And there are some neurodivergent friendly Girl Scouts groups in the greater NYC area. And then the last session is our graduation. And so this either would be something that would happen in the clinic, or depending on the interests and comfort level of the entire group, potentially could be an outing based on the shared interests of the group. And we would remain flexible to whichever seems to be the best fit for the cohort of kids that we have. So I will pause there because I know we'll have few minutes to answer questions. Just very quickly, here are the references. If you want to submit your questions, you can do so in the Q&A. And if you have any questions for us, I can show this up at the very end, our email and phone number. But I will pause this there so I can take a look at the chat for any questions. Okay, so I've got a couple queued up from people who registered, so I'm going to answer some of those. And then, of course, if you share things in the chat with the time that we have, I can certainly answer some of those things. So I got a lot of questions from parents about puberty, which I think is a very important topic. So I have some books that I wanted to show and share. Happy to send this out in either an email or I can put them directly in the chat. Maybe Lily Chin, you could tell me which is preferred. So I really like this first one. This is by Robin Stewart, who is an autistic writer, and wrote the Autism Friendly Guide to Periods. A lot of these books are going to be very illustrated, very clear. They explain things in detail, so I really love that one. Ones that can be a little bit more in depth about like bodies, puberty, that are really gender affirming, that are really body affirming, or anything by Corey Silverberg. So they're all, again, very nicely illustrated, which I think a lot of our kids really enjoy, and talk about all of these things in language that's really appropriate, developmentally appropriate, etc. So anything by Corey Silverberg, I think, is wonderful. Okay. And then the other one I'll add, that's another Corey Silverberg book. And then It's Perfectly Normal is another really great puberty book by Roby Harris and Michael Emberley. So all of those I think are great. Okay. And then questions about, or questions in the chat. Are there language accommodations? So we don't have I myself am an English speaker. And so, unfortunately for right now, this group would be for English speaking participants. I think, in the future, if we have the ability to add in a translator in the group, potentially, but I think the challenge is we also want the participants to be able to communicate with each other. So I think this time that would be an exclusion criteria, but definitely want to keep that as a potential to think about in the future. Age range for peers at NYU Langone, we have 3 different peers groups. One is for preschoolers age 4 to 6 or 4 to 7. We have a teen group for those age 13 to 17 usually. And then we have a young adult group for ages 18 to 35. In terms of our girls group, we are not actively recruiting at this exact moment. The hope is that we will in the future. And so I would recommend that folks stay tuned, and we will send out a flyer as soon as we begin recruiting for that. Ideally, this is a teen group for those ages 12 to probably 16 or 17. We want to make sure that it's a cohort that's kind of around the same developmental level. So that's a little bit dependent on who would like to join the group. It may trend a little bit older, it may trend a little bit younger. And then because this group is really focused on autistic self-identity development, one of the requirements is that those that participate have a diagnosis of autism, and are aware of their diagnosis. This wouldn't be the first time that they have heard about it. This recording is provided. I don't know if it's loaded online. That might be a better question for our organizers. There you go. So Lily Chin just added in the chat where we keep all of our recorded webinars. So yes, you'll be able to access that. Any other last questions? I know this was rapid fire. Okay, I know it is 1:30. but really wonderful to see how many people joined. I think that really speaks to, the interest here. That's all we have time for today. We've answered the questions that we have today, but please keep an eye out for upcoming flyers and activities related to this. And you can find a full list of our webinars provided on the link at nyulangone.org/CSC webinars. And we appreciate you taking the time.